guys, welcome back to my channel. Today in this video, we are going to study adverse drug reactions. The overview of this video is we are going to study the definition, types, etiology, signs and symptoms and treatment of adverse drug reactions. So let's begin. So what are adverse drug reaction? How do you define the adverse drug reaction? So basically, adverse drug reaction is a broad term and it is defined as a response or any response to a drug which is nauseous and intended. So basically, this adverse drug reaction is a response to a drug which occurs at the doses which are normally used for prophylaxis, diagnosis or treatment of any kind of disease. So basically, this adverse drug reaction occurs at the doses which are normally used for the treatment of a disease. In this video, we are going to study other terminologies regarding adverse drug reactions, which include adverse event. So basically, this adverse event is defined as any untoward medical occurrence which is temporarily associated with the use of the drug. So basically, this is an untoward medical occurrence and this is temporarily associated with the use of the drug and does not necessarily have a causal relationship with the therapy or treatment. So basically, this adverse event is an untoward medical occurrence which is not associated with the use of the drug and it also does not necessarily have a causal relationship with the treatment. The other terminology is serious adverse event. So the previous was adverse event and the next one is serious adverse event, which is defined as any untoward medical occurrence that at any dose results in death or any serious event like life-threatening congenital anomaly or birth defect, and this definitely requires an inpatient hospitalization. So basically, this is a serious adverse event which requires immediate inpatient hospitalization and it has to be taken seriously. So what are the types of adverse drug reactions? There are various types of adverse drug reactions, but the most commonly include type A, which is augmented reactions, and these type A reactions or the types of adverse drug reactions are dose related, meaning these adverse drug reactions are related to the dose and they are predictable from drug pharmacology, and these adverse drug reactions are common and reversible, meaning they can be reversed and they can be treated well, and these are manageable with the dose adjustment. So we have to adjust the dose so that the adverse drug reactions are minimized. So what are the examples of these adverse drug reactions, that is type A adverse drug reactions? Some examples include bleeding or the hemorrhage with warfarin, that is anticoagulant, and we can also see this type of adverse drug reaction in case of sulfonylureas, which upon consumption of sulfonylureas there will be hypoglycemia or decreased blood glucose levels. We can also see headache with glyceryl trinitrate, which is anti-anginal drug or which is used to treat the chest pain. So the other type is type B, which is bizarre reactions, which are not dose related, meaning these reactions are not specifically related to the dose, but they are non-predictable from the drug pharmacology, whereas type A are predictable from drug pharmacology, whereas type B or the bizarre reactions are not predictable from drug pharmacology. And these type B reactions or the adverse drug reactions are uncommon. They are not commonly or quite seen in the recent scenario, and these are irreversible, whereas the type A are reversible, and these are indicative that the drug needs to be stopped. So when a patient is suffering from bizarre reactions or type B reactions, then it is mandatory that the drug has to be stopped immediately. The types of or the examples of type B reactions include anaphylaxis with any kind of beta-lactam antibiotics, but specifically we can use penicillin. The penicillin may cause anaphylaxis. There is also hepatitis with the halothane, and agranulocytosis is seen with clozapine. So these are the type B reactions or Bizarre reactions. Next is type C reactions, which are chronic reactions, meaning the reactions could be chronic in nature, and the example include adrenal gland suppression or adrenal secretion, the suppression of the adrenal gland with the use of corticosteroids. Any kind of corticosteroids if we use, then it may lead to type C or chronic reactions, which is adrenal suppression. Next is type D, which is delayed reactions. The reactions which may come into picture, but there will be delayed reactions, and the examples include dyskinesia with neuroleptics or antipsychotic drugs. So the last type is type E, which will tell us the end of use. So basically there are some adverse drug reactions which will tell us that we have to end or stop the use of the drugs, and those include, the examples include use of benzodiazepines may cause withdrawal reactions. So how does this adverse drug reactions occur, and what is the etiology of adverse drug reactions? So there are three types of etiology or etiological factors of adverse drug reactions. The first one include dose related adverse drug reactions. This specifies that adverse reactions or adverse drug reactions are caused due to the dose, meaning the adverse drug reactions are related to dose itself. So these dose related adverse drug reactions are particularly a concern when the drugs have a narrow therapeutic index. So the examples include hemorrhage with anticoagulants, that is warfarin. So these are dose related adverse drug reactions, meaning when you consume the warfarin in higher amount, so that will cause adverse drug reaction. So this is specifically dose related adverse drug reaction, and these adverse drug reactions results from decreased drug clearance in patients. So basically, how does this dose related adverse drug reaction occur? So basically when the drug clearance in patients is less, or when a patient is suffering from renal or hepatic dysfunction, then obviously there will be decreased drug clearance in patients or from drug-drug interactions. And the next one is allergic adverse drug reactions. So allergic adverse drug reactions are not dose related and they require prior exposure to the drug. So basically these adverse drug reactions are not dose related, meaning these adverse drug reactions will cause, it does not cause when you consume higher amount of dose, but it will require some prior exposure to the drug. So these allergies will develop when a drug acts as an antigen or allergen. So basically these allergies will develop when a drug when any kind of drug we consume, when it acts as an allergen or an antigen. So that will cause allergy. So after a patient is being sensitized, now the patient is sensitized. So after or the subsequent exposure of that drug will produce one of the different types of allergic reactions like rashes, itching, etc. Next is idiosyncratic adverse drug reactions. These idiosyncratic adverse drug reactions are unexpected adverse drug reactions and may cause any time, and these are not these are neither related to dose nor they are allergic, but this idiosyncrasy is defined as an genetically determined abnormal response to a drug. So basically this is an abnormal response to a drug, but we can say not all idiosyncratic reactions have a pharmacogenetic cause, meaning the idiosyncratic reactions are not related to pharmacogenetic cause. So what are the symptoms of adverse drug reactions? So we can classify the symptoms of adverse drug reactions into 4 types, that is depending upon the severity: mild, moderate, severe and lethal. So basically the first one is mild. Here, in case of mild adverse drug reactions, no antidote or treatment is required, and also no hospitalization prolongation is required. So basically this is mild adverse drug reaction wherein no treatment is required, and also prolongation of the hospitalization is also not required. But the examples of these mild adverse drug reactions include after the consumption of antihistamines there will be drowsiness, and after the consumption of opioids there will be constipation. So these are mild adverse drug reactions and no treatment or the antidote is required. The next one is moderate, which tells us that a change in the treatment is required. That is, for example, we can modify the dose or we can add the drug with that drug. But it will not necessarily tell us that to discontinue a drug or hospitalization prolongation is required. So basically, this moderate type of adverse drug reactions, in these cases, so there is a change in the treatment wherein the dosage is modified or the drug is added with another drug. So the examples of these moderate adverse drug reactions include the use of hormonal contraceptives may cause venous thrombosis, and the use of NSAIDs will cause hypertension and edema. The next type of adverse drug reaction is severe. So this type of adverse drug reaction could be life-threatening, meaning it requires the discontinuation of the drug. So it could be life-threatening and it requires discontinuation of the drug or the stoppage of the drug usage. And the examples include the use of ACE inhibitors or angiotensin converting enzyme inhibitors. So these will cause severe adverse drug reaction, that is angioedema, and also the use of phenothiazines will cause abnormal heart rhythm. The next type of adverse drug reaction is lethal type of adverse drug reaction. It is an adverse drug reaction which contributes to patient death. So obviously this is lethal. So this is the most severe form of the adverse drug reaction which may lead to patient's death. And the example include the use of acetaminophen or paracetamol overdosage. So this overdosage of paracetamol may cause liver failure. So how do we treat these adverse drug reactions? So there are a few ways so that we can treat this adverse drug reaction. The first possibility is we can modify the dosage. If the paracetamol 500 mg is causing some kind of adverse drug reaction, we can modify the dosage to 250 mg. Like for example, paracetamol is taken. We can modify the dose however we want. So we can also discontinue the drug if necessary, and we can also use another drug regimen or dosage regimen. The third possibility is switching to a different drug. So if a drug paracetamol is causing any kind of adverse drug reaction, we can switch the paracetamol to some other drugs so that we can relieve the pain. So in case of dose related adverse drug reactions, we can modify the dose. We can modify the dose or eliminate the dose itself. Whereas in case of allergic and idiosyncratic adverse drug reactions, the drug has to be discontinued and not tried again. So basically, in case of dose related adverse drug reactions, we can modify the dose or you can eliminate the dose itself. In case of allergic or idiosyncratic adverse drug reactions, the drug has to be discontinued and should not be tried again. And the third possibility is Switching to a different drug class is often required for allergic adverse drug reactions, and also sometimes required for dose related adverse drug reactions. So in case of allergic drug adverse drug reactions and dose related adverse drug reactions, we can switch a drug to a different drug class. So this is all about adverse drug reactions. Thank you so much for watching. If you like this video, please like, share and subscribe so that you'll get notified every time I upload a